So imagine you're a scientist who wants to study the behavior of a certain fish. Could always travel to the correct sea where it's found and dive underwater to observe it, but just imagine how much time and money that would cost. Would it not be easier to study your fish of interest in an aquarium, allowing you to observe a small amount of the ocean in a more controlled environment without having to wade into the sea yourself? This is much the same concept behind microfluidics. Rather than studying a biological phenomenon inside the body by cutting the patient open, a microfluidic chip allows us to create a replica of the environment for the biological phenomenon. This can then be studied in isolation. To find out more about microfluidics, we spoke to an expert, Ali Mosayyebi, a PhD student at Southampton University.
9 million people in the UK and 45 million in the US have kidney stone problem. 2.7 million deal with bladder cancer and 1.1 million deal with prostate cancer through the whole world. These patients, they have one thing in common, and that is getting their urinary system blocked due to one of these obstructions. This builds the pressure in the kidney that could have an irreversible kidney damage. As a critical component in the treatment of all of these, stent is used in urinary system to allow the bypass of the urine from the obstructions and easing the urine drainage. However, more than half of these stents fail due to the crystallization and biofilm formation that costs a lot of money for healthcare providers and has negative impact on patient quality of life. I have used microfluidic technology and lab on a chip to design a platform that has allowed me to understand the mechanism of these failures and introduce new design to resolve these issues. So, lab on a chip refers to a technique in integrating one or a number of laboratory functions on a single integrated chip. Lab on a chip devices use microfluidic technology that deals with the behavior of fluids that are geometrically constrained to typically sub-millimeter scale. Just to give you an idea and to compare, human hair has a thickness of only 100 micron. So currently, microfluidic is used widely in designing diagnosing devices for infection diseases, handheld diagnosis devices, drug delivery devices, and analytical devices for research purposes such as analyzing very small volume of blood and cell counting.
The future of science is bright with microfluidics at the helm, with numerous benefits such as reducing waste products and the cost of reagents and allowing finer control of the molecular interactions. This technology can have a significant impact on not just bioengineering, but other disciplines as well. It all just depends on the design of the chip.